So one of the things that you focus on in your practice are helping patients that have dentures and they have problems with COPD or sleep apnea. And you say that the denture is making it worse. And there's an option with dental implants to help them.
Yes. If you're wearing a denture, you take them off at night, right? Now, once you go to sleep, your airway collapses. That doesn't need to happen. You can have dental implants where you support the tissue and the muscles of your neck and your face, and you can breathe better. And I have patients that have COPD or sleep apnea that said my sleep apnea had improved after I had my implants placed because you restore the height of your face, you restore the height of the air pipe. You need to breathe. In order for you to function, you need to breathe. Once you are on a horizontal position, everything with gravity will come down.
So denture wearers suffer from this,
yes.
like a really collapsed airway
yes.
when you have no teeth.
When you don't have teeth, everything collapses. And then you have harder time for you to breathe. Once you have the implants, your implants, upper and bottom, will support your airway.
Now, we've had your husband on the show, Dr. George. He says no more dentures. You don't like dentures either. So you believe that maybe giving them like a few, like 4 or 5, 6 implants, give them a full arch of teeth on the upper and lower that don't come in and out, and then they have less symptoms from their sleep apnea, things like that. Is that what you're saying?
Yes, that's correct. You don't need a bunch of implants in there. A lot of research has already shown that 5, 4, 6 implants on the top or the bottom, you can have a full set of teeth that you don't need to take them out. You don't need to take them out at night or anything else. They can function as your extension of your mouth. I mean,
and these people breathe better.
These people breathe better because their airway don't collapse. And it's a well-known fact that when you don't have teeth, your upper and lower jaw will collapse together. The tongue will go back. Your tongue is a very strong muscle, and it will go back into your throat, and it will prevent you from breathing. Now, a lot of people are using CPAP, which is a very
CPAP.
CPAP. That is a very uncomfortable machine to use with. But if you have the CPAP and you have your teeth, then you can breathe better, because then that air that is being shut up your nostril, they can flow into your lungs in a much easier way.
So they wake up rested.
They wake up rested, and they don't have so many episodes during the night of being restricted for air.
So this is a side of denture, of wearing a denture
that
we've never really talked about on the show.
That's a side effect that we are seeing more and more.
That their airway is blocked because they have no teeth, so
everything collapses in there.
Interesting.
Your bottom jaw just goes against your upper jaw, and what is in between just goes back. And what is in the back part of your mouth is your air pipe.
So get your teeth back with dental implants.
You have to get your teeth back. And you know, part of the reason why we don't see this is because we never live such a long life. These days, people, the average lifespan is 80, 85 years old. And then more people are living this long life without teeth. But you don't have to live in misery. You don't have to be uncomfortable. You can have your teeth back. You can enjoy a nice lunch. You can enjoy life. You can enjoy your grandkids. You can go on and about. These are just extension of your mouth. Those are extensions of yourself.
So these denture wearers, because I've had your husband on the show talking about no more dentures. So they come in just because they want to eat and chew better.
But they can breathe better.
And have a better smile. But the side effect is
they can breathe better.
They sleep better.
They sleep better. They breathe better. And in some of those people, they have said, look, we treat a lot of people with sleep apnea too, as well. And some of these people said, I snore way too much to the point that my grandkids don't want to go on vacations with me. Once you restore the teeth, these are a proper functional.
Snoring goes away?
Snoring sometimes goes away. He can go. I have a patient of mine. We deliver a sleep appliance for him because he said, I won't go on vacation because they don't want to go with me. He came back and he said, not just they slept better, I slept better, and I felt better. He had his teeth back, and he had a snoring appliance, so a sleep appliance. Meaning you need air. Any human being will fight to get air. If you don't get that air through the night, you're gonna wake up restless. You're not gonna wake up fresh and with the energy that you need. We need to be able to have to keep our body in a good energy mode. And if you don't have air, or if you have 10 episodes of sleep apnea during the night, that's not a good sleep. You told me last night that you slept 9 hours,
Yes,
right?
I felt good.
You felt good, but you didn't wake up 10 times during the night.
No.
If you wake up 10, 20, 15 times because you are gasping for air.
But these people think they're sleeping, but they're not sleeping.
Yes, they think that, well, I'm just gasping for air in the middle of the night. That's not normal. Snoring is not normal.
So you fix that.
Yes. Once you have teeth in your mouth, you can fix that. Snoring is not a normal pattern. When you snore, what happens is that the airway becomes so constricted that the air that goes through in and out is making noises. That means that you are squeezing out a big pipe. And it's kind of like if you put your finger on a hose.
Yeah.
Then you're not going to get any water. The same thing, you're not going to get any air. Once you have teeth back on those patients, then they can have a better life. They can have more energy.
And you see like this all,
And we see it like that all the time. I have a patient of mine. She came to me extremely sick. She couldn't get up in the morning because she felt that she didn't sleep the whole night. She was having her dental implants. She had all her teeth replaced with dental implants. She has something that she cannot remove from her face. She said, I have never felt better. I can breathe better. And I feel better. And feeling better, that means that you have more energy. Nobody's going to tell you, I don't have energy, but I feel better. If you feel better, you have more energy.
Good.
And you don't need that extra cup of coffee during the day. You don't need to be lethargic in the middle of the day. You don't need to get that extra cup of coffee. We relied a lot on a lot of medications, coffee, anything to make us more awake. We don't need to do that. We can have our teeth and we can have our life back because the body just functions the way how it's supposed to function. With air, with our precious air. And that's it.